everybody. After today's meeting, there was a couple questions on laying down and how to sleep at night. And I know there's some therapists that will say it's good to sleep on one side, or it's not good to sleep on your affected side. Personally, I think putting weight on your affected side is good because what I've read at least is that it helps wake or send signal to your brain, which helps activate that side a little bit faster. So if you can get to a place where you're comfortable sleeping on that side, it is definitely beneficial. You just have to be careful with causing a lot of pain. And I don't expect anybody to be able to sleep completely throughout the night all at once in the beginning, because it is going to be uncomfortable and your brain is going to try to fight you with sleeping on that side. So it is definitely something that you have to work up to being able to be comfortable on that side. But if you practice it, and if you practice it during the day at least, you will get to the point where you're able to sleep comfortably on that side. So a little disclaimer, everything I've been telling you is to help you progress during your therapy and trying to get the most benefits you can. However, if you do have a therapist, consult with them first, or your doctor, about doing these situations. Everybody is a little bit different. If you do have any joint pain or any spasticity, putting weight on that side is supposed to help you. However, every condition is a little bit different and you don't want to cause any extra pain. So just be careful. Like I said, it's something that you have to work into. And I just know that the faster you do it, in the sense of in your progression time, the easier it gets and the better you're able to put weight on that side. So just be mindful of that. So I'm just going to give an example of how you're supposed to lay down, if you can get, or not supposed to, but how you can get comfortable. If you're laying down on the affected side, you want to make sure that your arm is not right underneath you, but maybe it's that your shoulder is pulled out a little bit further so that you're not laying completely on there. And you want to have a pillow. So I have a pillow right here under your neck, so that is supporting the weight of your neck. So this is kind of a better position for your shoulder and to lay on comfortably. However, when I understand that some of you can't put your shoulder into that position, so you may have to ask somebody to grab you by the shoulder, not pull the arm, but grab by the shoulder and bring that forward so you're not laying on your shoulder completely. The other thing is, hopefully your back is slightly turned so you're not completely sleeping like this. You can, if you're not completely turned on your weaker side, it is better than putting all the weight, especially in the beginning. You can put a pillow back here. So if I grab this pillow, you can put a pillow so you don't turn back onto your back also. And then some people will feel comfortable putting a pillow in between your knees, like that. Another way is to not stagger your legs so you're not completely one on top of the other. So that is a way to put some weight on your weaker side. It will definitely help wake that side up a little bit more. It's something that is easy to do. You just have to get comfortable in that position and make sure you don't cause a lot of pain. So what I suggest is to practice before you try sleeping that way, because the other thing is practicing will help you maybe get comfortable in that position and maybe adjust, so you can see how you can figure out how to adjust so you're not stuck in that position all night. I hope this helps. Till next time.